Okay, let's get started. So, welcome everybody and hello. Welcome to another session of AFTO's Fresh Take Fridays webinar series. I'm your host today, Sally Flowers. Today, we're going to learn about a successful approach to food safety training that is yielding some lasting positive results. We have an excellent speaker joining us today, but first, just a little bit of housekeeping. We are recording this session, and all who registered will receive a link to the recording, as well as a copy of the slide deck in the next few days. If you have any questions for our speaker, please place them into the Q&A box below, and we'll address them either during the Q&A session afterwards, or if you want, we can do that during the session. So we ask that you do use that Q&A tool instead of chat, because that makes it easier for us to see your questions. So if you do want to ask a question verbally during the presentation, if you would select that raise hand feature at the bottom of your Zoom screen. So if you want anything clarified, please feel free to do that. And then once we recognize you, we're going to prompt you to unmute. Lastly, I'd like to remind participants that the views and opinions expressed during this virtual event are those of the presenter and not necessarily the Association of Food and Drug Officials, or AFTO. Participation in the virtual event does not necessarily constitute an endorsement of the speaker's views, products, or services. This virtual event cannot be used to train AI models. Now it is my pleasure to introduce our speaker. Rosa Stilbell has been with Boulder County Public Health for over 13 years. She has been part of the Oral Culture Learning Training Project since it started around 10 years ago. Rosa teaches classes in both English and Spanish, along with presentations to clients, industry, and the public. As environmental health specialist too, she also helps with epidemiological investigations for foodborne illnesses. She contributed to the development of the online Train the Trainer for oral culture learning, and you can find these materials on the website from the Colorado Integrated Food Safety Center of Excellence. And we're going to place this link into the chat. The valuable materials that are on this website are available in English, Spanish, and Mandarin. So here's the website. And now it's my pleasure to turn this over to Rosa.
Thank you, Sally. Good morning or good afternoon, everyone, depending where you're joining us from. Again, my name is Rosa Stilwell. I'm an environmental health specialist with Boulder County Public Health. Spanish is my first language, and I focus mostly on food safety. Today, I will be presenting to you the Oral Culture Learning Project and Train the Trainer project that our team here in Boulder County developed. I'm going to start by giving you a little bit of history and background of this project. So Boulder County, just as many other local health departments, we offer food safety classes in English and in Spanish. Now, way back in the day, we offer them here at our offices, so people would have to register, they would come to our office, take a test, and then we could get all the results and put them into a spreadsheet. A little after I started working here at Boulder County, they asked me if I wanted to start conducting the Spanish food safety classes, and I was very happy, and I said yes. So I started doing the classes, and I thought things were going great because I could see people were, nodding their head. They were asking some questions, some participation. However, the test results were telling me something completely different because the average score was about 55%. I took a peek at my coworker Marshall's English class, and his scores were much higher. And yes, he is an excellent presenter. However, I felt like the Spanish speakers had to been scoring higher, but there was something going on there. So after doing some investigation and talking to people, I came to find out that our food workers that are Spanish speakers have lower education levels. Therefore, they have some literacy challenges. So here we were giving them these classes that were heavily presented in printing, and then at the end we would give them a test that was approximately 20 questions, multiple choice questionnaire. And so if you're someone who doesn't read very well, there's just no way you're going to raise your hand and say, excuse me, but I don't read very well, can you please assist me? So I figured that was probably the problem right there. It was actually us failing them and not them failing the test. So I went to talk to my supervisor and I told her about my concerns with the Spanish class. And she told me actually there is a grant going on right now. FDA is offering this oral culture learning grant. It's a 5-year grant that is based off of Dr. Donald Beagle's research, which states that food workers overall are more visual learners than they are printed learners. So we applied for the grant. We were extremely lucky to receive this grant, and our team got to work on creating a different, well, it was not a different class, creating a different method of teaching this class. So we went back, we took out a lot of the words, and we put in a lot more pictures. So we made it somewhat interactive, and we thought we had like this excellent, super perfect food safety class. We were very proud of our work. However, we said, let's test it first before we go out. So we decided to present it to our outbreak team here in Boulder County. The outbreak team consisted of epidemiologists, other environmental health specialists, emergency preparedness, nurses, just overall a nice group of public health workers. They're professionals, but not necessarily experts in food safety. So we told them we are going to present this class to you. It's a basic food safety class, and we want you to tell us anything that you may think we can do to improve this class. Now, we were expecting like standing innovation at the end because we thought we had like the best presentation for a food safety class ever. However, they changed every single one of our slides in that presentation. We began by doing this presentation in Spanish, and they said actually the presentation is in Spanish and most of us here are English speakers. And we told them that the reason we put up the presentation in Spanish was because we wanted them to have that similar experience of someone who has challenges reading. What do they go through when they are in a class with a presentation where there's words in there that they actually cannot read? So they took out, I would say, probably 90 to 95% of all the words that were in our presentation. They took them out. We pretty much had to replace them with pictures or videos or things like that. So after that, we went back, made all these changes again, and then we felt we had a better product after making all these changes. So one thing we learned there is that we really have to know our audience. We have to make sure that you know your audience and what is the best way they learn, because if you don't do it, if you would show something like all pictures to a group of scientists, you would probably drive them crazy, right? So one of our slides, this is what it used to look like before. So in this slide, obviously we talk about bacteria and viruses, and as you can tell, this, just by looking at it, this slide does not tell you anything that these bacteria and viruses have anything to do with food. So if you are a food worker, this slide really is not going to help you at all with your day-to-day work. So this is what our slide looks like now. So we show them this picture of raw chicken, and we ask the class, we say, okay, so who in the class can tell me what bacteria or virus is commonly found in raw chicken or raw poultry? And once we hear somebody say salmonella, we click on the answer. And we do the same thing with other bacteria and viruses such as Listeria. And then we ask again, who knows what bacteria or virus is commonly found in ground beef? And once we hear somebody say E. coli, we do that same thing with touching ready-to-eat foods with bare hands, norovirus, obviously. So we do a little bit of education here, talk a little bit more about, the bacteria that are found in the food and how to avoid it. This is what one of the questions used to look like. So as you can see, there's a lot of reading. So this one question says, bare hand contact with ready-to-eat foods must be avoided to prevent the transfer of viruses and bacteria, which may cause foodborne illness. Which is the correct way to handle ready-to-eat foods when serving? A, touching a sandwich with your hands. B, holding a cookie with a spatula. C, cutting fresh produce for a salad using a knife and a cutting board only. Or D, taking a slice of pizza with your hands. Now this was just one question, so they had to read 20 questions and 4 different answers. This is the way we actually teach, we test them now. So we show them this picture. Actually, I'm sorry. We tell them, we're going to show you 4 pictures. Only one of the pictures is the correct answer. So please let us know which do you believe is the correct answer. So we say, which is the correct way of handling ready-to-eat foods? A, touching a sandwich with your bare hands. B, touching a cookie with a spatula. C, cutting produce for a salad. Or D, handling pizza with your bare hands. So all they have to do now is pretty much write down their name and then just circle the answer they believe is actually correct. This way we pretty much overcame the barrier of anybody having any issues with reading or writing. So regardless of anybody's education level, we are now able to get true test results of what it is that they know, what it is that they actually are learning. So these classes that we conducted during this project are very unique in the sense that they are now presented at the restaurant and not in our offices anymore. They are interactive. We cover the foodborne illness risk factors, and we also test them before and after the class so we can measure knowledge. Now, as you can see, I did this on purpose. I put this up in Spanish. So you could have that same feel of what a person that has challenges reading goes through. So were you trying to actually, if Spanish is not your first language, were you actually trying to read what was up in the presentation? Were you trying to figure out if what I was saying matched with what the message in the presentation is, or did it not bother you at all? But anyway, so if I do the exact same presentation slide in the oral culture way, this is what I would do. I would say, okay, our classes during this project are very unique because we offer them at the restaurant. There are actually studies that show that people learn better when they are in an environment that they feel comfortable. So what better place at their own restaurant? We make them interactive, so we are not talking 2 hours straight. And so we make them participate, we make them talk. We actually go to the kitchen, we open up refrigerators, and we just spend some time in their kitchen. We also cover the 5 foodborne illness risk factors, and we test them before and after the class so we can measure knowledge. Again, as you can see, 2 completely different ways of delivering the same message, of saying the same thing, yet if you have any problems or difficulties reading, or if you are just a visual learner, this is probably a better way, a better method to teach you. So we recruited 20 restaurants during this project, English and Spanish speaking restaurants. And some of those requirements for these restaurants was that they had to have a fail inspection. They also had to be a local restaurant, so we did not do any chain restaurants because usually chain restaurants have their very own resources. And they had to have approximately 10 employees or more. However, we did do these classes with some restaurants that only had approximately 6 employees or so because we figured they could really take advantage of this project. So we would talk to the restaurant and tell them, okay, we have this project going on, we're gonna come in, train your staff, and we believe this is gonna help you with your inspections overall. There is no cost to you. However, the catch is that there are going to be 4 follow-ups. So after the class, 6 months later, two different inspectors, went and did the first follow-up. On the first follow-up, one of the inspectors conducted a routine inspection, and the second inspector was making the employees take that test that they had taken on the class 6 months prior. So we printed the test, but we would verbally ask them the questions, and all they had to do was point at the answer they believed was correct. So we did this for a period of 2 years, 4 follow-ups. So the inspector who conducted that class was not the inspector that did any of these follow-ups. We rotated pretty much just so we could make sure that we were getting true results. Now, I went back and I gathered some of the information, some of the data that we had from 2010 to 2013. And as you can see, the Spanish speakers were averaging 58%, while the English speakers were averaging 91%. And this was one of the biggest concerns I had. I'm like, there can't be that big of a gap. There's something going on. And now, after the project, we did a lot of data analysis. And with these 20 restaurants, we had 274 participants, both English and Spanish combined. And the average pre-test score that we got from all those 274 participants was 65%. Well, the average post-test score was 93%. Again, this was combined English and Spanish. Now, just so you know, the participants that were still employed at the same restaurant who had taken that first class, so out of those 274 participants, only 18 were actually still employed at that restaurant. So that's another challenge that the restaurants have to face. This is a little piece of the data spreadsheet that we have that we collected during this project. So for every single one of those 274 participants, we recorded every single one of the answers on the pre-test, on the post-test, the first, second, third, and follow-up tests. So this spreadsheet is humongous. So this helped us a lot because our data analysis was able to give us a lot of information, such as are the English speakers testing, getting this one particular question right versus the Spanish speakers, were they getting the same questions wrong the first time versus the second time. Also, there was some information that we found out that people were getting the one of the questions, I can't remember exactly which one, but one of the questions they were getting it wrong on the post test, and it was coming up pretty frequently. So we figured we were not being very clear, or we were confusing people. So we went back and we changed that slide, and then we noticed that people were then started getting that question correct. So all this information that we had was extremely helpful to do different types of studies. In this chart right here, the green line represents Spanish speakers, the blue line represents English speakers. So as you can see on the pre-test, so before we started this class, there was a big gap, 74% versus 56%. So after we conducted the class, then we tested them again, given the exact same test. They scored, it was less than 10% of difference between English and Spanish speakers. So right there, we were able to see that it was actually not the way we were teaching food safety. That it was not them not being able to learn, but it was us, the way that we were teaching the food safety class. So on the first follow-up, we were pretty much measuring knowledge retention by then. And the gap between English and Spanish was only 2%. which indicated to us that really doesn't matter which language you speak. If you learn something and you learn it well and in a way where you can actually retain that knowledge, it does not make a difference what language you speak, what level of education you have. Again, on the second follow-up, the gap was still 2%. Same thing on the third follow-up, the gap was still 2% between English and Spanish. And then on the fourth follow-up, the gap was even closer. It was only 1% difference. However, for some reason at that time, we got both English and Spanish speakers a 50+% test score, which to us indicated that maybe at this time it was time for us to go back and do another class and do a refresher. Or maybe they were just like literally sick and tired of seeing us and they were just, just answering to answer. I don't know. But also when it came to the inspection scores, so with us, the higher the points you get in your inspection, the worse off you did in your inspection. If you get 50 points or higher, you fail your inspection. So as you can see, the average was a little bit below 80% for all 20 restaurants. And this was before we conducted this class. Then on the first follow-up, 6 months after we conducted the class, that number of points went down below 40, which was a very big change. Most of them passed their inspection. At the second follow-up, that number decreased, and it just continued decreasing all the way up to the fourth follow-up. Now, we did have 2 restaurants that stayed at 120 points, which was pretty much immediate closure, but they did very poor during their inspection, and they continue to do pretty bad on their first, second, third, and fourth follow-up. The reason for that is because both of these restaurants had male Spanish-speaking owners that did not feel very comfortable taking orders, as they said, from females. And we tried to get to them and tried to tell them that it was not us trying to give them orders, it was us trying to help them. We wanted them to improve their inspections, and we try to talk to them a lot. One of those 2 restaurants actually did end up cooperating, but the other restaurant never actually did. So something we learned with that was that without management buy-in, this class is not effective. So you have to also make sure to understand the culture of the restaurant, and if you think that having males versus females may work better, that's something that you need to consider. So part of the learning in this class, and the reason it's called oral culture, is because we tried to change the culture in the food staff employees. Make them understand not why food safety is important, but the consequences of it. So this is one of my favorite slides. In this slide, we talk about little Brianna, 3-year-old, who goes to a restaurant with her mom, her dad, little brother, and they all become sick with E. coli. Now, 60 people became sick with this eating from the same restaurant, so this was an outbreak. I explained to the class what an outbreak is. An outbreak is when more than 2 people from different households become sick from eating from the same source. So it was actually proven that they all ate at this restaurant, and that same E. coli was found at the restaurant, and it was in their meat. I also explained to them right there that just like humans, we all have our own DNA. Bacteria and viruses also carry their own DNA. This is the way how they can actually prove that people got sick from this restaurant. And if you become sick with E. coli, it does not automatically mean that you became sick from the same restaurant. So anyway, I explained to them a little bit about that. And the interesting thing about this case is that little Brianna did not eat meat. she only ate fruit and salad from the salad bar. After continued the inspection, they found out that that same E. coli was found in the watermelon, and Brianna actually did eat watermelon. So obviously, when Brianna ate that contaminated watermelon, that's how she became ill. Now, at this point, I asked the class, what happened here? And I wait for them to respond to me, and usually they say cross contamination, because we do cover cross contamination slides prior to this one, so they understand how cross contamination works. So at this point, they understand that. They say, yes, it was cross contamination. And I say, okay, yes, very good. So, what do you guys think happened here? How did that E. coli that was found in the watermelon was also the same E. coli from the beef? So I let them answer that, and someone will say, well, somebody probably touched the raw meat with their bare hands, then washed their hands and went and touched the watermelon. And I'm like, yes. What other ways? What about storage? They say, yes, maybe somebody put the watermelon underneath the beef and the beef leaked and the watermelon became contaminated. Yes. And so on. I let them give me different scenarios of how this watermelon became contaminated. And then I tell them, so nobody ever found out who contaminated that watermelon or how that watermelon became contaminated, but it did cost Brianna's life. She actually passed away. So somebody decided that throwing the watermelon under the beef was not important. Somebody thought that washing their hands is not a big deal. Somebody skipped a step, and that step cost Brianna her life. So I tell them, next time when you're in the kitchen and you think that something is not that big of a deal, next time you don't feel like you want to wash your hands, think about Brianna, how it cost her life. So I always make sure that they understand how important their job is. Us as inspectors, I tell them we are very limited when it comes to preventing this, because we come in, we do our inspections, we write down the reports, we tell them what violations we found. We can do all the education we want. However, it's really in their hands whether they prevent this from happening or not. So I always like to tell my classes, your job is so much important than mine, because you can actually make somebody ill. So we, as you can see, this project was very successful, and we felt like we could have continued this project, but unfortunately we did not have the funds. So that's what where Train the Trainer project came. So we bundled up all of our training materials to conduct this class, and we call it Train the Trainer. So pretty much what we want to do is managers or other local health departments to train themselves so they can actually go and conduct these classes at the restaurants. This way they conduct them however many times they need to do it. They can do it every 6 months, they can do it once a year. It does not matter, because all of these materials are ready there for them. So in this package, we have three presentation slides. One of them is the food safety class itself. Now, the food safety class itself, as I said earlier, there's very little words on this presentation. So what we did is we recorded a video of the presentation and telling you exactly what you have to say in every single slide. So we'll tell you, okay, in this slide, what you have to say is this. We're going to talk about this. Make sure that you ask your class acts and things like that, so you make them participate. Then we also did a transcript of that video. So let's say you are doing the class, you get stuck in page 32, you forgot what you have to say on page 32. You can go to your notes, go to page 32, and right there it will have a description of what it is that you have to say. We did this with the food safety test and also the cross-contamination game that we created. That's an interactive way of teaching them food storage and cross-contamination. We also let them know what it is that they're going to need, which is a screen, a projector, and a speaker. In this package, they also receive 2 videos, 2 FDA foodborne illness videos. So again, we do a lot of stories, so we want to make sure that they understand that foodborne illness is not just a number. When you hear it on the news or things like that, you always hear statistics. So many people became ill, so many people got hospitalized, but you never see the story, you never see the face. And this is what we like to do in this class. We want to put a face to all of those foodborne illnesses that happen out there. We also give them the PDF for the pre and the post test. And instead of regular sheets of certification, we just give them a business size card where we ask them to write their name, we sign it, we date it, and the back of the card, they have the cooking temperatures, so they can actually put them in their wallet. And I actually have run into people who have actually showed me their card, and it's been very rewarding when I walk into a kitchen and I see some people pull it out of their wallet. All of these materials can be found at the Colorado Integrated Food Safety Center of Excellence. So if you go to the website, you're going to tab on the trainings. You're going to click on the trainings tab, which is going to take you to the list of trainings that they have. Click on the Oral Culture Learning Train the Trainer Toolkit, and that will take you directly to our webpage. However, they did post the link that will take you directly to this page. All of our materials are available in English, Spanish, and Chinese. And the videos, everything is already translated. And I also want to share with everyone that the Colorado Integrated Food Safety Center of Excellence has a great resources, not just this Project Train the Trainer, but it is just tons of great materials. So I encourage you to take a picture of the QR code and navigate this website. Boulder Valley School District is one of the school districts here in Boulder County, and they are very invested in food safety. They would invite us once a year, right before school started, to go and train all of their kitchen staff. So once we got this Train the Trainer toolkit together, I asked them if they would be interested in conducting these classes on their own, and they said yes. And they invited me to go the first time. And here's Sarah Acker, and she conducted this class, and it went out just great. Now, also, we have a Nepalese community here in Boulder County, and we have a lot of restaurants that are very small, so they only have 3-5 employees each, and they were all struggling with their food inspections. So what we did is we had one of those restaurants host a food safety training class, and we invited all the Nepalese restaurants to come in. We had about 30 participants, and as you can see, I am giving this class, doing the class in English, and the person standing next to me is translating in Nepalese. We did it the exact same way as we always do. We did the pre-test, the post-test, and we were shocked when we saw that the results were exactly the same as we did in our project, which was they had a 60 plus pre-test average score, and after the class we got a 90+% average score. And some of these actually Nepalese restaurants are doing very well now in their inspections. So this is one thing that actually has been working very well for us. So if you have a small community that you are struggling with, we invite you to do the same thing where you conduct this class, have a translator, and hopefully it can help you. We also have our neighbor, Seating County of Broomfield. They are actually using our materials, and they just put their logo on all of our materials. So you can download these materials, put your own logo in it, and use them as as you need. So that is pretty much it for me. Thank you so much. If anybody has any questions, I'll be more than happy to answer any questions, but I do appreciate your time spending it with me.
Rosa, that was amazing. And we do have a few questions. I want to start off with one request. Would you be able to go back to the slide that has the QR code? We had a request to have that shown again. Thank you, ma'am. And now we're going to go to our questions. I'm going to combine a question that was asked by a couple of people here.
Hmm.
And so it relates to the use of your materials. So
Yes.
several of our participants have asked if they could have your permission to use some of your photos, your slides, your guides for their purposes of doing training or for updating their food handler exams.
Yes, absolutely. Our materials are, again, in this Colorado Integrated Food Safety Year of Excellence. One thing I do want to mention is that when we did that class with Boulder Valley School District, they did not download it, the materials. They were using the materials straight from the website, and some of the pictures got distorted. I don't know why. So I would encourage everybody to download all the materials. And just like Broomfield did, they took all of our materials and all they did was just put in their logo and took ours out. So yes, this is the reason why we're sharing this, and that it's the reason why it's in the in this website, because we want everybody to take advantage of it.
Fantastic. Thank you. And then does that mean also that the materials that are on this website could be used to develop training at their own jurisdictions?
Yes, absolutely. Yeah.
Okay.
Again, Brimfield is using it, and we just did a pre-conference at the WAFDO at a WAFDO conference, and we know that one jurisdiction was saying that they were going to be using all of these materials. So yes.
The next question, how does a county get the grant to carry out the same type of training for food facilities?
We got this grant through FDA. As far as I know, these grants are now provided by NEHA. So this was back in 2016, I believe, when this grant was available through them. And it was open to anybody to apply for it. We applied, and that's how we received this grant. So I'm not sure if there are any other grants available like this, but you can always contact NEHA, or there are other different organizations that offer grants, and ask if you can get something for to conduct a similar project.
Thank you, Rosa. I have two more questions that are written here. And so I want to ask the participants here, if you have a question you want to ask live, just click that raise hand icon at the bottom of your screen, and then we will find you and then we'll ask you to unmute. So Rosa, the next question I'm seeing here, if employees speak both English and Spanish, did they have a tendency to choose to take the class more frequently in one language over the other?
Um, that is a very good question. I've had some restaurants where I went and did the class in Spanish or in English, actually. The most recent example I can give is I did a class in Spanish at a restaurant, and two of their employees were English speakers. So, because our presentation is mostly visual, they attended the class, and whenever they weren't following something, they would just raise their hand and say, "What is it that you said right now, here and there?" And then I would answer, I would repeat myself in English. So I don't know anybody, no one has ever told me directly if they, prefer to do it on one language over the other one, because the class is usually done just in one language. But I've had people taking the class in English or in Spanish while they speak a different language, if that makes any sense.
Thank you, Rosa. And it looks like we do have one person that raised their hand.
Hi, yes. Kevin, I am going to allow you to talk. You are going to have to unmute yourself and then you should be able to ask your question. Oh, it looks like you put your hand down.
Okay.
All right.
And if that changes, we can certainly come back to you, no problem. Thank you
Yep,
for
if
that.
that changes, please just raise your hand again.
Thank you, Amy. Rosa, our next question for you. How did you select the restaurants for this training course?
So when we did the project, the way we selected at these restaurants were we selected those restaurants that were struggling. So if they had a history of failing inspections, and we knew that they were a local restaurant with limited resources, then we went ahead and made this offer to them. Now we continue offering this class. We do charge now $300 per class. Um, so, but during this project, like I said, we selected them based on their inspection history. And if they wanted to participate, because it was something completely volunteer. So every single restaurant that we asked actually did accept it.
Thank you, Rosa. The the question I now see is actually a question for AFTO. Yes, the slides and recording will be made available to you. We will send those out. We have your email address. So thanks for asking that. Do we have other questions for Rosa? And I can place the link one more time into chat for accessing the Train the Trainer on the website.
And my information is right here. If you want to contact me directly, feel free to do so. I'll be more than happy to help anybody.
And during the time, Rosa, it looks like we had one more question come up. Do you get a lot of, so to speak, takers charging when charging $300 per class?
We do actually. It is. I don't know how to say it, but I think people do see the value of it because when they know that we will come in, we do this class at the restaurant, and we not only do this, by teaching them with a presentation, but we also go to their kitchen. We open up refrigerators, and I say, okay, tell me, is this a timeless temperature control food? Yes or no? Why not? So we do have a lot of exercises that the employees do, and like I said, people actually are able to retain a lot of this knowledge for a good 2 years. So the way they look at it is a good investment. There are some restaurants that have, or some owners that have 2, 3 restaurants. So what we tell them is like, get everybody in one facility and we can train everybody. So we do some classes that are very large. We've had classes that are up to 50 people. But especially those restaurants that where the owners English is not their first language and they struggle themselves, so for have us come in at the restaurant and train them, it's very valuable. So yeah, we do get a few requests from our restaurants to get this done.
Rosa, we had two more questions pop up in the Q&A, and I'll read the first one off to you here.
Yes.
If I want to give this to a Spanish/Mandarin speaking class, would I have English notes and the slides in their preferred language?
I'm sorry, can you repeat that again?
Sure. If I want to give this to a Spanish and or Mandarin speaking class, would I have English notes or maybe notes in English and the slides in their preferred language?
The slides again have minimal writing in them. So I don't think the slides, it matters if you do it in English or in any language you do. I have by mistake sometimes used the Spanish slides in an English class, and it has not made one single difference. The notes, it would depend on what you are more comfortable with. If you are doing your class in Spanish, I would suggest that you have your notes in Spanish. but it really doesn't matter because that really depends on how comfortable you are um, when you're doing this class. But the presentation itself, again, the writing in the slides is very very minimal. So you can, if you have both Mandarin and Spanish speakers, it's not going to matter which one do you which slide do you put, because there's not going to be much reading they're going to do. There are some temperatures there up there that you're going to see, in the slides. The slides that I show with Brianna, that's one of the slides that has the most writing in it. So it doesn't matter. It's whatever you're more comfortable with, or whatever you think your audience would need more.
Thank you again, Rosa. And here's this question. By the time of the 1-year follow-up test, how many employees are remaining that actually took the class?
I don't have those numbers in front of me. I would have to go back and look at our database, but it reduced by a lot. Just on the 6 months, I have to say it was probably less than half of those people. In the food industry, people move around a lot, and that is one challenge that restaurants have, and that's one of the reasons why we wanted to do train the trainer, so the owners or the managers can continue doing this class, because people just don't stick around when it comes to in the food industry.
And Rosa, we're getting lots of comments in chat, and thank you, great information, how useful this is. And okay, I have one more question that just popped up. How long is your class typically?
The class is approximately an hour and a half to 2 hours. So we start with the pre-test, and that's not a great way to start the class, but we always tell them we need to measure knowledge. We don't give the owners or the managers any of the results individually. We tell them your class score this pre-test and your class score this post-test, because we want to make sure that we actually get true numbers. So we encourage them to, give us what they believe is what they know. And but yeah, it lasts usually an hour and a half to 2 hours, and we usually conduct these classes, because we do them at the restaurant early in the morning. I've done them as early as 6 o'clock in the morning, and as late as 7 p.m. at night, or sometimes on the weekends. So that's one thing, you have to be very flexible with the restaurants. You have to be respectful of their hours. It is their business. So yeah.
Thank you, Rosa. Thank you very much for your presentation and for answering this wealth of questions. And also thank you to all of our participants for your attentiveness and for your great questions today. And so, as we mentioned at the beginning of this, please look for a post-webinar email. And this is going to include links to the PDF version of this presentation, as well as a link to access the recorded session. And we did place a couple of links into chat, and we'll make sure those are also available in this email. And so for our next Fresh Take Fridays webinar, that will be November 21st. So be on the lookout for this one, plus other presentations in November. On the 21st, it'll be Professor Don Schaffner and Jim Arbogast, and they're going to be discussing hand hygiene myths. So thank you very much, everybody.
Thank you, everybody. Thank you, Sally.
You're welcome.